Hi, everyone. We are here with a special Mental Health Awareness Month video to discuss some really important topics related to mental health. So, to get us started, I am going to have us introduce ourselves with names, pronouns, what you do here at Chase Brexton, and in the spirit of mental health, what your favorite self care activity is. So I'll get us started. My name is Kat Connard. I use she, her pronouns. I am a therapist here at Chase Brexton in the Behavioral Health Department. And my favorite self-care activity is spending really good quality time with my loved ones.
Nice. I will jump in next. My name is Jason Manning Beekman. I am a professional counselor or therapist here in the Mount Vernon office in Baltimore. I use he, him pronouns. And my favorite self-care recently has been micro self-care because I just don't have time to do a ton of big things. So Google it. There's an article you can find lots of options, but the option I picked was changing all of my passwords to something funny or to relating to something that just makes me feel good. Like I love sunflowers, so maybe I change it to sunflower or something. So all throughout the day when I'm typing in my passwords, I just get a little bump and a little moment where I can smile, and it's incorporated easily into things I already have to do. So that's mine recently.
My name is Lauren Vassal. I am a therapist here in our behavioral health and substance use teams, or as I like to say, just all of our teams, because those two components of care are very interconnected and closely connected for so many of the folks that we work with, let alone all of us. In terms of self-care, I really enjoy being outside in nature. That can be taking a walk, taking a hike, going for a run, but I feel like it's just very grounding. No matter if it's cold or warm out, it's just a really nice way to reset. So, thanks.
I'll go next. My name is Dhanashree Chada. I go by she, her pronouns. I'm a mental health therapist here at Chase Brexton. One thing I do for self-care is I love spending time in the nature, outdoors. It really helps me disconnect with the daily stressors and really connect with myself, my thoughts, and my emotions. So that's something I try to do on a regular basis. Thanks.
I love it. I love all the self-care. So we have a lot of things that we could talk about related to mental health. The first question that I want to ask about is about access. And so we know that there are a lot of barriers to access with mental health. I feel like I personally have noticed that access has gotten a lot better with telehealth over the last few years. And so I would love to hear all of your thoughts on if you feel like you've noticed a positive change in access, what you still see as barriers to access for people receiving mental health services, and how you see this affecting the people that you work with every day.
Jump in. I think that telehealth has been tremendous. Um, not needing to go 2 or 3 hours on the bus and public transport or even just driving into your appointment. It has really provided an opportunity for people to take that moment away to take care of yourself, which even as we were just talking about self-care, we talked about these small, brief moments, but then these larger acts. Self-care and really taking care of ourselves does not need to be a few hours of an endeavor. It can just be even 20 or 30 minutes. And telehealth has provided such an opportunity for that. I can jump on my phone and I can just really quickly connect for this session, and then I can go back to my day-to-day life and just the different tasks and activities, because we all have so much going on that I think the ability to even engage in care is such a privileged opportunity to be able to take that 2-3 hours away from work, from school, from whatever it might be, childcare, to be able to engage in therapy. So telehealth has been great, but it's such just a small step up from where we really need to be. And part of the challenge in that is just really making sure that there is open access to services. Um, And also, I think something that I've been trying to evaluate for myself a bit more is also different models of care, and recognizing that therapy doesn't always have to be very long term. Sometimes it can be, but sometimes it's also short term. Sometimes it's getting in and really getting those initial skills to just feel a bit more comfortable and confident, and then shifting forward.
I can jump in as well. I definitely will say I would agree that there has been some improvements. I guess I'll specifically related to some of the expertise that we hold here at Chase Brexton. I think our little bubble at Chase and the people that we serve are so fortunate to have these resources in specialty care, but there are many people throughout even Maryland who don't have access to specialty care around trans issues or around sexuality and exploration of sexuality and identity and whatnot. And I think that the expansion of telehealth has really allowed us to provide services to communities that I mean, we're still getting supported obviously, but by clinicians who themselves knew that they were trying to learn as they go and whatnot. So telehealth has allowed us to really maximize and efficiently use the expertise that we have in Maryland. So I think that is a positive, especially also if you want to like find a therapist that might look like you or look a little bit more similar to you. That is so hard. That's still not a super easy thing to do in our field. And so the access that telehealth has opened in regards to that is awesome. I guess my equity effort that I would push for access still is I've been seeing it a lot recently for individuals who are uninsured and who may not be able to be insured through the means we have here in America. And our health system is just not really set up for for self-pay. And so to do that would just be so expensive. So the opposite is that they're just not getting care. And so I know Chase has efforts where we try to make it as available and accessible, which is great, which is why I'm seeing a lot of these individuals. But I know for that one individual, there's like 10 more that aren't getting care and that don't have access. And so I would say expanding services by either providing more grants or expanding our definition of who can be included in our social safety nets would be a really good equity effort for pushing forward mental health.
Yeah, I have to agree with all thoughts shared. I think one great thing that did come out of the pandemic is increase in utilization of telehealth services. And I also agree with you, Jason. I think being able to have a therapist that looks like you, because representation matters, and that's also a really big piece. When I think about barriers, we talked a little bit about external barriers. I think things like insurance and other factors that prevent you from coming to care. And I also often think about internal barriers. I think a lot of times many of us are thinking that we can keep it together. Maybe I can push, maybe I can take a break, maybe I'm going to be fine. And sometimes when you have, when you're developing a mental health condition, at some point you might need help. You may not be able to do it by yourself. And so being able to work with that part of it and accepting that, this is something that could be good for me and helpful for me could be, something that we all can reflect on and realize we need it.
And Dhanashree, I think the point you brought up of feeling the need to just keep it all together, I think there's also such a stigma about mental health in general, and especially within different communities, there's different layers of stigma associated with that. And so one of the things that I will say that I've just experienced over the years of working in the field is also the ability for a group setting, so for group therapy, to really break down some of those stigmas, because you start to see I'm not the only person. Like, we're all talking about the exact same thing, the exact same experiences, the exact same thoughts, the exact same emotions. And having that recognition that we all share these experiences can be so key and so just life-changing and empowering. So.
I agree with that.
Yeah, Absolutely. And I'm so glad you brought up stigma because it's one of the other points that I wanted to touch on today. Because there is a lot of stigma around mental health and around asking for help, exactly like you were saying, Shri. And one of the reasons that Mental Health Awareness Month exists is to raise awareness and to reduce stigma around it. And so I feel like similarly, where there's been a lot of shifts in access, I think there's also been a lot of shifts in stigma. Like I've noticed there's a lot more people who are accessing services now, which I take to mean that there's more acceptance around it, and there's a little bit less stigma. But we do know that there is still a lot of stigma surrounding it. And so I wanted to ask, like, what are the ways that we see that showing up in our work? And I'll share an example because I know, Lauren, you said that there's like all these layers of stigma, right? I had a patient recently who was saying like how all of like her friends in her circle were commenting on like how good it seemed like she was doing, and like we're asking what was going on, and she was like, I've been in therapy. And her friends were like, really, therapy? And one of the things that stuck out to me was that they said, isn't therapy for white people? And it's like there are so many different ways that like stigma might show up, which I think is also why, like, to the point of why representation is so important, that we have more therapists that look like the people who are seeking services. And so while there is like, I think, a growing acceptance, there's still a lot of work we have to do. So I wonder what you all think about that and how you see that showing up.
I will say, as a privileged white woman working in this field, being able to recognize and acknowledge just that inherent privilege that I'm bringing into the room, and really hearing where people are at and what they're coming in with, I think the representation is so key and so important. And I recognize that there will be components of that that I will never be able to meet as a provider. But I also think my insight and awareness to that can be key in being able to not fix those gaps, but hopefully in some ways fill some of those gaps until there is more representation within our work. And so really making sure that everybody that is entering into our field has diversity training and is aware of the diversity between each and every one of us. And I think there's been fortunately a shift in that. Probably need a bit more of a shift, but I think there is a part of that that makes it a little bit more challenging for people to enter into care, because again, there is that stigma associated with it. And so being able to again recognize that we're all going through this, I think that's been one of the beneficial things with the pandemic and us having these conversations about mental health, because we're starting to hear people at all different levels of our culture saying, yeah, I experience mental health issues as well. And that can be so empowering. And I think of how empowering it is to adults, but think of just how empowering that is to children and teens and adolescents that are going through similar experiences and don't have the language to even put labels on that, because for so long we weren't taught that. I think, yeah, it's a big shift.
I'll just jump in quickly with like a little bit of a different addition to, as someone who sees a lot of children and adolescents, stigma is so hard because stigma really thrives in secrecy and shame. And I think our recent pushes in our society to educate everyone about what mental health is, what it looks like, what it's not, is so important, because so many of the parents that I come in contact with will say to me, I just wish that I had someone to talk about this with sooner, or like, really, it's that common that this happens? Like, I've never talked with someone about it. And then 3 months in, they're like, oh, I've now talked to 3 of my friends and their child actually self-harms just like my child. And I'm like, oh my gosh, see, it is a more common thing than you may think. And so I think with stigma, I'm a big proponent of education. good education. Definitely look for the right resources that really lay things out in a more research, just kind of here's the data and information way, because I know a lot of people want to share their thoughts and feelings and whatnot, and that can sometimes confuse actual like experiences and stuff like that. So I think getting the right education is really important too, but I think that piece, along with the representation and all the other pieces, helps to bring that secrecy piece out and bring all of this to the light, which I think helps with connection, which then helps with wellness.
Yeah, I 100% agree that I think normalization of mental health care is like super important to increase access further. And I also noticed that a lot of times, I think like Jason was mentioning, like the stigma also comes from like people around us, family members. Sometimes they could be close ones to you and they're like, maybe it's not that, maybe you're going to be fine, like invalidation of whatever you're experiencing. And that is something I talk about when I work with people, that what is your understanding of how others are looking at you coming to care, and how you're able to understand that that stigma is a larger part of the problem and not related to you having a mental health issue and seeking care. And I think some other things could be common things like how we identify with mental health disorders. Sometimes we say you're acting bipolar, or you're acting like a depressed person, rather than recognizing that, we're not walking, talking diagnoses. What we are is that we're experiencing a part of that. And so being able to change the language around that, understanding around that, increasing awareness around that could be a very, very big part of continually addressing stigma, and hopefully at some point really being able to address the issue on a more systemic level.
Both mentioned points that made me also think a little bit more about the stigma associated with substance use. So Jason, you had mentioned like the secrecy and how that really fosters it. And I think we tend to get so, there's so much shame and guilt around substance use, and it's seen as this moral failing. And I think fortunately, there's been a lot more education in our culture over the past few years. I am like singing that praise all the time, that this is something that people go through, and it is not, you don't have enough will. You're not able to just pull yourself up by your bootstraps and get through it. It really is, it's a medical condition, and it's something that needs to be treated, and something where we need more supports for folks around that. I always talk with people when I start working with them for substance use. I always say to them, nobody grows up saying, I want to start to use this substance and become addicted to it. It's something that transpires because of all the other things that are going on in our world, and all of those stressors and those challenges, and a lot of times not having the opportunity to learn from a really young age what are some of these healthier coping skills to work through it. And I think that's why the work that Kat and Jason, the two of you, do with children and adolescents, and Dhanashree, even you with adolescents, I think it's amazing and so key and so important, because it really can provide such an opportunity for these kids to grow up just differently and not have to transition into some of those just longer term struggles that sometimes we face when we don't have those skills developed early on. Because yeah, there's all that's been going on, like I said, even just in the past few weeks, that can definitely lead people to shutting down and closing off, and using a substance sometimes can be a really tempting thing, because it's an escape emotionally.
Absolutely. And I feel like I have heard so much in what each of you has said that could be its whole own video discussion that we do on its own. Like Shree, like you were talking about diagnoses and the language that we use and how we talk about mental health. talking about how we like the stigma around even asking for help. Like Lauren, I had been thinking the exact same, like the pull yourself up by the bootstraps mentality that we have in America, and how that leaves people feeling like they need to do it on their own, or that they shouldn't be asking for help around things. And coping skills, like I'm sure that we could do a whole huge session around coping skills, but we are getting to be at time for today. So I want to thank you all for this awesome discussion, and to stay tuned for more, because there's clearly so much more that we have to talk about. And I think our mental health team will be back with more discussions.